So we'll talk about pleural effusion. So pleural effusion is disease that affected the pleural cavity. So what is pleural effusion? Is excess fluid in pleural cavity. So as you can see, this is a normal pleural cavity, and here we have a pleural effusion. So you have excess fluid in the pleural cavity. So those will push the lung and take from the space, will compress the lung. So we'll take a space from the lung. What will cause excess fluid to accumulate in the pleural cavity? There are different reasons. So if you know how the pleural cavity actually works, so we'll understand, if you understand a little bit about physiology, we'll understand basically about pathophysiology of pleural cavity. So why the fluid will be accumulated in pleural cavity? There are two transitive problem. Is either problem, it's a problem with blood pressure. So we know that in the blood we have two main pressure. We have one pressure. So we know in the blood vessels we have two main pressure. We have hydrostatic pressure. So hydrostatic pressure is the pressure that caused by heart pumping the blood, and it will cause a pressure in the blood vessels. Hydrostatic pressure is the pressure that is called pushing pressure. So it will always push things from blood vessels into tissue. Okay. What will cause hydrostatic pressure problem? When the patient has heart failure, for example. So we have problem with the heart pump. So blood are not pumped very good. So the fluid will start to go away from the fluid in the tissue. So this is the pushing pressure, okay? The pushing pressure is very bad. So then the fluid will accumulate in the pleural cavity, okay? Oncotic pressure. Oncotic pressure, so the hydrostatic pressure will increase. Here oncotic pressure will decrease. That will cause transitive problem. So what will cause oncotic pressure to be decreased? We have to know first of all what will make oncotic pressure. Oncotic pressure is formed because we have albumin inside blood. So albumin are made by liver. So because we have an albumin inside blood vessels, that will cause the solid concentration to be high inside blood. So solid concentration is very high. That will allow osmosis to happen. So what is osmosis? Osmosis is moving of fluid, okay, from low solid concentration to high solid concentration. So the fluid, so oncotic pressure, it's called pulling pressure. So it will help pulling the fluid and everything inside the tissue. So it pull the thing from tissue into the blood vessel. Pull with the help of osmosis. So the fluid will move from the low concentration to high concentration to balance the concentration. The fluid will move to the highest concentration inside the blood vessel, which caused by albumin. If the patient for any reason have a disease that will cause his oncotic pressure to go low, so like what? Because we said liver is the organ that make the albumin. So if the patient have a cirrhosis, so liver not function properly, liver actually has died, so the patient cannot produce albumin. Or if the patient have nephrotic syndrome, nephrotic problem, that filtration, the kidney will filter protein out. So normally we cannot see protein in urine, okay? But because we have problem in kidney not function properly, so the protein will be excreted, albumin will be excreted in urine, so we'll have less albumin in the blood, and this will cause the encrotic pressure to be decreased. Okay, so we said heart failure will cause low hydrostatic pressure, and problem with protein production will cause encrotic pressure to be low. So if first reason for pleural effusion transitive, second reason is exudative. Exudative is the inflammation of blood vessel, so we have inflammation in blood vessel, so blood capillary space will be widened, so that's why fluid, protein, immune cells will go outside the blood vessel and move into the tissue. This is due to inflammation of blood capillary or pneumonia. We'll know now about pneumonia, it's infection, or maybe cancer disease that happen to the blood vessel will cause them to lose their elasticity. So the fluid will be exudative from the blood vessels toward the tissue. Finally, patient also can have a problem. So patient can have problem with lymphatic system. That means patient cannot clear away the fluid from pleural cavity, and that's because of, for example, trauma. If patient have an accident, so something hit his lymph system around his lung, or surgery, so then the fluid will be accumulated in the lung, and that will compress the lung, so the patient will have restrictive disease. He cannot inhale normally because we don't have enough space. The lung will be shrinked, so the lung will be smaller than the normal size. Finally, we'll talk about pneumonia. So our last topic is pneumonia. So what will cause pneumonia? Pneumonia is the infection of the lung. So normally in lung we have a normal defense mechanism that will help us to fight infection, bacterial or viral infection. However, patients with a very long history of smoking, they can lose one of their defense mechanism, which is, so microciliary system will be lost, so they cannot produce mucus, ciliary system not working properly. That's why when the organism like virus or bacteria invade the lung, they can colonize and form colonies inside lung and invade the tissue and cause disease. And another problem, the patient will, that they don't have the other mechanism, which is patient who cannot cough normally, they cannot cough, like patient with ventilation, patient with who use ventilator. So those patients cannot cough. Patient in coma or anesthesia, they cannot cough. So that organism can invade easily to the lung. Also, patient who doesn't have a macrophage. Macrophage is a normal tissue or normal defense mechanism that exists, a normal immune system that exists in alveoli, and it will defend against the microorganism. So, as I said, in pneumonia, it can be caused by viral, it can be caused by bacteria, and it can be caused by fungal. So, in viral, normally like influenza, those viral are famous to do pneumonia, okay? Bacterial, we have two types of bacterial that can work in pneumonia. So, we have Streptococcus aureus and influenza. And in fungal, it's very rare to get infected by fungal, but only in immune suppressed patient like diabetes or AIDS patient. Those patients, they don't have a good immune system to defend against fungal, so they can invade and cause diseases for them. So we have different type of, we can classify the pneumonia into three different type. To acquired from community acquired pneumonia, or hospital acquired pneumonia, or ventilator acquired pneumonia. Ventilator, for patients with ventilation, they can acquire infection from ventilator tube, and in hospital a patient can also acquire pneumonia from other patients, and those pneumonia that caused by hospital one are very severe because it caused by bacterial and viral, which is resistance to antibiotics and treatment in the hospital, so they become more harsh and they can cause a very severe disease for patients. And finally, acquired from community, also pneumonia. We need to know the stages of pneumonia. So pneumonia, it will go through different stages. So in stage 1, it's called congestion. So stage 1 is congestion. So in stage 1, it occurs within 24 hours of infection. Okay, the lung is characterized by vascular congestion and alveolar edema. Many bacteria and few neutrophils are present. So bacteria high, neutrophils low. Okay. In stage 2, it's called hepatization. Hepatization because of its similarity with liver. So the color of the lung will be very reddish, okay? And here, why the color is reddish? Because we have a lot of erythrocyte, which is blood cells, RBC. We have neutrophils. We have desquamated epithelial cells, and we have fibrin. So because some damage start to happen in alveoli, so blood vessels also, so RBC will start to come inside, and we have congestion. In stage 4, or gray hepatization, so degradation of red blood cells, it become a gray because there's degradation. RBC or erythrocyte will be degraded, and fibrobrulent exudate. So will be exudation of fibrino, okay, fluid. And then final stage, which is resolution. We can call it resolution or healing. So resorption and restoration of pulmonary architecture, fibrinous inflammation. So it will be release, and then the lung will come back to the normal situation. Please go back to the slides, read through them to understand more, and that's all about respiratory pathophysiology. Thank you so much, and good luck.